Hello, I'm John Foster, and I'm a medical doctor who does Social Security disability exams. And today's video is aimed at patients claiming disability, and it's about how to describe your pain. As usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, pain is involved in the majority of disability cases, and time and again I see patients having problems describing their pain, and that can really hurt their chances of being approved. So today I'm going to give you tips on how to best describe your pain to give you the best chance of having your disability case approved. The number one type of pain in disability cases is what doctors call musculoskeletal pain. That's pain coming from your muscles, bones, and joints. Low back pain is an example. Knee pain is another example. However, there are other conditions that may cause disability which also cause pain. Headaches are a problem with the nervous system. Heart disease may cause chest pain, and Social Security considers chest pain due to heart disease very significant. Stomach and digestive system problems can also cause pain, as can problems with the kidneys and urinary tract. To start off, I'd like to try something different. I'm going to simulate an encounter between me and a patient, Mr. Smith. And I'm going to do it two ways. In the beginning, I'm going to have Mr. Smith make as many mistakes describing his pain as possible. See if you can find the mistakes. If you've watched some of my previous videos, you'll likely spot quite a few. At the end of this video, I'm going to re-encounter Mr. Smith, and this time he's going to do everything right when he describes his pain. So, Mr. Smith, would you please describe for me today the medical problems you have that are making you disabled? It's my back. What sort of problems do you experience with your back? I have 3 bulging discs and 2 herniated discs. Does your back hurt? Well, of course it does, and the pain radiates to my legs too. Does anything make the pain worse, especially work-related activities? No, it's constant. It's always there, and it's always excruciating. I'd rate it a 10 out of 10. What about sitting, standing, or walking? Well, I can't walk too far because of the pain. Does anything help the pain? If I take my pain medication, I feel pretty good. And as well as the pain, do you experience any other problems? Yes, my left leg feels funny. So that was as many mistakes as I could come up with. Let's talk about the first one. If you have pain, you need to tell the doctor. Doctors who do disability exams don't guess, and they don't make assumptions. When the patient says, "It's my back," I don't know what trouble he has with his back. Is it painful? Is it stiff? Are there certain movements that the person can't do? You must tell the doctor if you have pain. The next mistake was describing the MRI findings on a lumbar MRI. As I've stated many times before, no doctor can tell what problems you experience from your muscles, joints, or spinal discs, or even if you have any problems that you experience from those structures based on your MRI. There are thousands of patients with no neck or back problems whatsoever who have MRIs which are read as abnormal. So please don't discuss your MRI. Tell the doctor what problems you experience with your neck, back, or joints, or anything else. So first, you want to let the doctor know that you have pain And then you want to let them know where you experience the pain. If you can point to the area, that's very helpful. Next, it's very helpful for the doctor to know if the pain spreads or travels anywhere from the place where it originates or is the most severe. But please don't use medical terminology unless you're a doctor or a nurse. And I've had plenty of doctor and nurse patients. Imagine that the doctor who is examining you is a friend and describe your problems in the layman's language as you would tell a friend. Avoid words like radiation. Instead, say, I have this back pain and it often goes down my leg. The next thing a doctor wants to know about any pain is its quality. And please, when the doctor asks what is the pain like, don't say excruciating. That's what 90% of people do, and it provides no extra information. We know that your pain is unpleasant. Also, if you claim to have 10 out of 10 pain, which is the worst pain imaginable, and you're sitting there calmly talking, the doctor is going to believe that you're an exaggerator. You're going to lose credibility. Believe me, doctors have seen patients with 10 out of 10 pain. Women in childbirth, people passing kidney stones, folks who've been in a bad accident and broken their thigh bones, and even people who've been doused in gasoline and set on fire. Those people can't sit in a chair and answer questions calmly. When the doctor asks you what is the pain like, what they want to find out is it, for example, dull, like a bruise or a pressure, or sharp, like a knife or being stuck with a nail, or burning, or tingling like an electric shock? If you can describe your pain in those sort of terms, it can be very helpful. Now, some pain is simply impossible to describe, and if that's the case, just tell the doctor, I really don't have words to describe it. Another useful thing to know is the pain constant, or does it come and go? The causes of constant pain are usually quite different than, for example, pain that pounds with your heartbeat or comes and goes like cramps in your stomach. For example, you may be surprised to know that pain from heart problems is always or almost always constant rather than throbbing with the heartbeat. The next thing that's very important is what makes the pain worse. Doctors call this aggravating factors, and here you really must give some thought to work-related abilities. Remember, those are the abilities to see, hear, sit, stand, walk, lift, carry, handle objects, speak, travel, understand, remember, concentrate, persist, interact socially, and adapt. If your pain is to help your disability claim, it almost always must be made worse with work-related activities. In my example, Mr. Smith said that his pain was constant and nothing made it worse. It was always there and always the same. And in that sort of case, I always wonder, well, if the pain is the same no matter what Mr. Smith's doing, why doesn't he go to work? He'll have the same amount of pain whether he's working or sitting in an easy chair at home. And when it comes to aggravating factors, it's very helpful if you can be specific. Saying that my back hurts if I walk too long doesn't really give the physician much of an idea of what's going on with you. Does that mean if you walk for 1 minute or 10 minutes or 1 hour? There's a big difference in the ability to work between somebody who can only walk for 5 to 10 minutes and somebody who can walk 1 hour. Likewise, if your pain is made worse by lifting or carrying a heavy object, it's really helpful to specify how heavy is heavy for you. Is that 1 pound, 10 pounds, 50 pounds, 100 pounds? Here's a tip. A gallon of milk weighs 8 pounds. If there are any small children in your family who weigh 20 to 30 pounds, can you pick them up and carry them or not? Are there specific movements or positions that make your pain worse? For example, low back pain is often made worse by bending forward. Well, how far forward can you bend before your pain gets worse? Shoulder pain often comes on when the shoulder is moved in a particular way or position. You can show the doctor what position or movement causes your shoulder to hurt. The next thing the doctor will want to know is, are there any things that make your pain better? What medical professionals call relieving factors. These can be medications, or they can be physical things, such as lying down in bed, using a heating pad, or an ice pack, or massage. Mr. Smith said that his excruciating back pain was well relieved with medication. In that case, I'm going to wonder, well, why can't he take the medication and go to work? On the other hand, a person with back pain who needs to lie down after they've been sitting or standing more than half an hour is going to have significant impairment of work-related abilities, because there are very few jobs that are going to let you lie down and rest every half hour. Here's another mistake that I've seen. Don't tell the doctor that you can only sit for a maximum of 5 minutes due to pain, and then sit there comfortably for 15 minutes answering the doctor's questions. Finally, the doctor's going to want to know, are there any other symptoms or problems that you have besides the pain? In medicine, we call these associated symptoms, and there can be all sorts. For example, you might feel dizzy or actually pass out. You might sweat, become nauseated or vomit, have abdominal cramps, diarrhea, problems with your urine, or you might get numbness, tingling, or electric shock type feelings in various parts of your body, or be weak. All of those associated symptoms will be quite useful and helpful for the doctor in determining what's wrong with you and how impaired are you. So, to finish up, I'm going to re-interview Mr. Smith, and this time he's going to do everything correctly and give himself the best chance of his disability claim being approved. So, Mr. Smith, please describe for me the medical problems that you have that are making you disabled. Well, I've got a lot of pain in my low back. It's right here in this part. And it's pretty steady and kind of like a dull pain, but sometimes if I bend forward too much, it feels like somebody's hammering a nail into my back. Does the pain spread anywhere? Yes, I often feel pain going down the outside of my left leg all the way to my foot, and sometimes going down the right leg too, but mostly the left. Does anything make the pain worse? Let me tell you, the absolute worst thing is when I cough or sneeze. When that happens, my back goes crazy and I get this feeling running down my left leg like a burning electric shock. It's almost unbearable. And the other things that make it worse are if I lean over more than about this far, or if I pick up something heavy more than about 10 or 15 pounds. Does anything help the pain or make it better? Well, the doctor prescribed me these Percocet pills, and they help fairly well, but the problem is, when I take them, I'm so doped up I can barely function. I feel like I'm in La La Land. And besides the symptoms you've described, anything else gone wrong along with this pain? Well, no, not much. I pretty much told you everything. The only thing is, sometimes when that left foot is numb and I'm walking up the stairs, for some reason my left foot catches on the stairs and I almost tripped a few times. Okay, so let's go over what Mr. Smith did right this time. Number one, he informed me that he had pain and told me where the pain is and where it spreads to. He described the character of the pain. He described the factors that aggravate the pain, and he was quite specific in the amount of weight that he could lift and how far he could bend over. He described the fact that Percocet made the pain better, but, and this is very important, he explained that Percocet made him feel doped up and in la-la land. That's going to be a real significant problem with working because you can't work when you're doped up. And he described well in layman's terms the feelings he was experiencing in his left leg, which included numbness, electric shock, and pins and needles feeling, what doctors call paresthesia, and the fact that sometimes his left foot wouldn't move normally. And this is typical in patients with low back pain and sciatica, pinched nerve coming out of the low back and running down the leg to the foot. Finally, this time Mr. Smith did not describe his MRI or use medical terminology. He explained his problems in his own words. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.